Hello, everybody. I'm Jody, and I've been a doula for over 20 years and a childbirth educator. And at this stage of my career, I have arrived at a place that I feel the most important thing that I can do with my time is to raise awareness about peripartum cardiomyopathy. I jotted down some words so that I could get to my point without rambling too much. So forgive me while I indulge in checking out my notes here. Um, I want to give you my why and what I want to do is to raise awareness about this condition among birth workers. Um, if you know me as a birth worker, you know that nobody trusts birth as much as I do. I I believe that women know how to conceive a baby and grow a baby and birth a baby, and the babies know how to grow and they know how to come out. Um, but I found myself learning about PPCM about 2016. Several things happened during that period of time, beginning with learning that my daughter's childhood friend went into cardiac arrest several weeks postpartum. She survived and lives with a an implantable defibrillator pacemaker and lots of medication and two young sons and a loving husband. And then in 2017, my husband John was diagnosed with sudden onset systolic cardiomyopathy, and it was believed to be brought on by a virus. When he first followed with his primary care physician, the first thing that was done was he had noted swelling of his extremities and shortness of breath. So he made an appointment, and the first thing they did was draw some blood. The very next day, his results came back and showed an elevated level of something called BNP. And he immediately went to a cardiologist and had an echocardiogram. And let me say that the levels of his BNP were extremely high. They were 1100, and a normal BNP is less than 100 for a normal adult. Next day, with an echocardiogram, it showed that he was in severe heart failure with an ejection fraction of 15%. So I proceeded to learn everything I could about cardiomyopathy, congestive heart failure. At his visit with the cardiologist, we began to talk about peripartum cardiomyopathy and the fact that with me being a doula and my daughter's friend being diagnosed with the condition, I had a new cause. And so since then, while spending every day trying to keep my husband healthy, and he too has a defibrillator pacemaker in his chest and lots of medication, and he's doing well. I'm also committed to preventing women from developing this condition. The challenging thing for me is to raise awareness, yet not burden birthing families with undue concern, and yet another reason to try to view birth as a risky medical event at such a time when so much of what we've been striving for is so exquisitely happening every day and before our eyes, thanks in part to social media. And also at a time when it seems as if the more opportunities women have to experience safe, empowering out of hospital births, we're seeing even greater attempts to control more and more of the process, a RIVE study notwithstanding. I deeply believe that awareness of PPCM for families and friends must simply manifest as commitment to informing one's providers as soon as something feels different or off. As doulas, we are so often first responders as to how our clients are feeling. Thus, we must be the ones to empower our clients, as always we do, to insist that they get appropriate attention to any concerning symptoms. And so, with that being said, I am going to introduce Brianna Harris Henderson, a friend and a doula colleague. Brianna is the founder and CEO of Let's Talk PPCM, a certified patient family partner, patient advocate, doula, and best-selling author. She is also a loving wife and mother of 2 children. She was deeply inspired to provide comprehensive prenatal and preventative education after surviving a missed diagnosis during her pregnancy and postpartum season. After recovering from her pregnancy-induced heart condition and learning what took her sister's life, Brianna dedicates her time to ensuring that mothers and families are informed during the prenatal year. She fulfills her heart's mission through professional doula support and her nonprofit organization. And here's this magnificent creature right here, Brianna.
Thank you, Miss Jody, for having me today. Being able to discuss PPCM and to also introduce my story. Around my 36th, 37th week of pregnancy is when I had noticed some fluttering in my heart. And I knew it felt weird. It was something different than I discovered from the first pregnancy that actually didn't have certain symptoms that I did or that I was experiencing during the second pregnancy. And so with the fluttering, I end up just, randomly asking my obstetrician if she can check out my heart, if she could listen to it while I was during my prenatal visits. And so she had gave me this look like, okay, like she was like, we normally don't do that, but she wanted to make sure that she was listening to me. And so she did, and she said, yeah, you have a murmur, and she said, but it's a harmless murmur, it'll go away after the baby. It's just something that can commonly develop during pregnancy, with a heart murmur, so nothing to worry about. So I didn't worry about it anymore. So some time had passed, well, the weeks that had passed by, I didn't really notice anything strange outside of swelling. I did started swelling, and then I was working as well, so I didn't take no leave off work or anything because my career they didn't provide us with like maternal care or anything like that. So I just stayed working, even though I was swelling, but I would sit down here and there. I wouldn't do too much. But from there, is everything was normal until I had my baby girl. And so once I gave birth, I ended up going into a severe hemorrhage, and I was totally unaware of what was going on. I didn't know to be on the lookout for a hemorrhage or anything. I do know it took about 30 minutes before my obstetrician was able to remove the placenta. And so with that, I didn't know that it was any type of restrictions or any type of risk or anything involved to look out for after a mom has trouble with the placenta releasing. And so from there, I do remember her asking me if I knew my blood type. And I told her, no. I said, was I supposed to? She was like, oh, no, don't worry about it. We'll get it, but she didn't let me know why she had asked that. So I left it alone because after she got the placenta out, everything looked fine. I was able to eat again and, hold my baby. And that was pretty much it until about 10 hours later. I had noticed that I was like filling up the long pads that they give you in the hospital after you give birth. And I still didn't think anything, of it. I was like, okay, well, this is, a multiple pregnancy. So I know things happen differently with different pregnancies. So I'm not going to worry about it. I'm going to just change that and get back in the bed. So I did that. And I just really just started feeling icky, like when it started filling up again. So I went to get in the shower. Well, I actually called the nurse in there told her my issue, that I was bleeding, and I told her, I had to, keep switching the pads. And so she was like, "Well, the next time you feel one up, call me in here and let me know, and I'll take a look." And I said, "Okay. Well, in the meantime, can I take a shower?" And so she was like, "Yeah, you can take a shower." And I was like, "Okay, cool." And so I went and took a shower. And it was just blood just running down my legs. And even in the shower, I know that sometimes, like being a woman, that when you shower, that water can actually stop or slow down the blood flow. But in this case, it didn't do that. And so I was literally still didn't think anything of it. What I did was, once I got out of the shower, I had wrapped my feet in towels, just to move around the bathroom, because I was literally dropping blood everywhere, like it was unstoppable. And so I just went ahead and sat on the toilet from at that point, to just kind of get my legs and everything situated. And so from there is when I heard like droppings in the toilet. And so when I looked in the toilet, it was just like full of clots, blood clots. And so at this point, I'm still not thinking anything is wrong. I'm like, "Oh my goodness, after this pregnancy, dropping clots. Like, oh my goodness, I didn't do that the first time, but I'm thinking that it's normal, right? Because nobody told me to be on the lookout for anything, or I wasn't warned that anything like that would happen or could happen." So I just, fixed myself up and went and got back in the bed and laid down. And so I ended up filling up another one. And that's when I was like, "Okay, let me, before I take a nap, I'm going to go ahead and call the nurse back in, and, like she told me to do." And so when I called her in there, it took her about 7 seconds before she had picked up her nurse phone and basically called a bunch of other nurses and workers in there at that moment. And from that moment, I had ended up fainting due to severe blood loss. And so once they was working on me, I remember hearing a few things. I remember them, how they was working around the room. I couldn't open my eyes and see them, but I was able to hear how they was really working hard to save my life. And so from that point on, I think it took them probably about less than 30 minutes maybe to get my obstetrician back up there, because at this point she was already gone, until they had contacted her with that. And then from there, they had to put me to sleep quickly. I went into a 5-hour surgery. And from there is when they let me know that, hey, you had bled out too much, and, letting me know the details of what happened, and like the severity of the situation. Because I believe my blood count was about a 6. So it was supposed to have been around like a 12. And yeah, so they said that I had lost half the amount of my body. But that wasn't really, I guess, the so scary part. At that time, it was scary, but as the story progresses, I end up going home. I was discharged, but before I was discharged, I had asked the obstetrician, because of me going through this severe blood loss. I remember, about the murmur in my heart. So I was telling her if she could at least check out my heart to see, if anything had changed from me bleeding out. And so she did. She didn't hesitate. She was like, "Okay, we can definitely do that." And so, but at this point, since I had severely hemorrhaged, they didn't want me walking around. So they had to have a echocardiogram come up to the labor and delivery floor, just to be able to see how my heart was doing. And so before I was getting discharged, that she did let me know that, "Oh no, everything looked fine. My heart looked fine." And, there was pretty much no worries at that point. And so once I left, I continued mommy duties, and just around the house, until like 2 weeks later, I had developed a cough, and it was like a regular cold cough, like, so it wasn't nothing drastic or anything. I didn't feel severely bad or anything. Just like how you feel when you have a cold, a sinus infection. That's exactly what it felt like. And so I was prone and used to getting sinus infections, so the cough and didn't really bother me. But it did progress over the weeks at a time. So about 3 4 weeks in postpartum, I know I started swelling again. Or at least like the swelling never went away, but it was like more noticeable, I would say. And then like the cough got more aggressive, and then also with just the shortness of breath, I started getting slowly started getting shortness of breath. So my shortness of breath didn't start when the coughing started. It started some weeks later, So I could, I guess that's the point where moms can really get confused in that time frame, because I didn't know that something severely was going on. But from that point, I was taking sinus medications. I was trying to take other medications, and even the medications my dad suggested that I can take, over the counter, but nothing was working. And so at that point, I was like, I'm gonna just have to let it pass over, And my dad was the one, like, he was saying, "No, I don't think you need to, wait. I think you just go ahead and go to the doctor." And I was like, "No, I got the baby and everything. I don't, want to take a chance taking her out and going to the doctor and stuff." And my husband, he had to work. He was working a lot then, so I didn't want, him having to worry about anything. So all this was basically me not wanting no one to worry, not wanting, while I did need assistance. And so what happened was, it was the night after, no, the day after Christmas, or the night of Christmas, in 2016, is after we was done with our family gathering. When we got home, I had trouble getting to our front door. It was like a struggle for me walking from the car to our door, and so my husband literally had to, help me out and help me get into the house at that point, because I was so out of breath. I was like, "Oh my goodness!" Even though I just walked over here, it felt like I just ran, and I was trying to describe it to him. Of course, him being new to everything, he, wasn't aware of anything that can be a red flag, including myself. So, um, after I got in, I remember just falling on the couch, and I was just like trying to catch my breath, because I was like, "Oh my gosh, I'm so tired." I felt like I just ran a race. And so from there, I pumped that night. And when I was pumping, I felt my heart beating really, really, really fast. And like it was a pounding fast. And so from that point, I asked my husband if he could listen to my chest. I was like, "It sounds like my heart is beating really fast, or it feel like it is, listen to it." Even though he's not a medical personnel, but I mean, he was closest thing, right? So he listened to it, and he was like, "Yeah, it do sound like it's beating fast." And so me, I was like, "Oh, okay. Well, I guess, it's just from me pumping, that was it, because I'm not thinking anything is wrong. I mean, nothing is wrong, right? I'm not going to speak that over myself that nothing was wrong." And so I didn't. And I left it alone until that night. So once I was done pumping, uh, I laid down, and I literally got up, gasping for air, because I couldn't, like, it cut my windpipe off as soon as I laid flat. Like, as soon as I laid on my pillow, I couldn't breathe at all. I felt like I was underwater. So I had immediately got back up, and I was like, "Oh my goodness, I guess I just got to sit up." I said, "This is a really bad sinus infection. It never got this bad." And so I remember leaning over, and I texted my dad. It was like 3 or 4 in the morning at this time. And I was like, "Dad," I said, I couldn't breathe when I'm laying down, having trouble, sleeping." And so he was like, "Oh, Bree, that don't sound good. You need to really go to the hospital, not like now. You need to see about that, because shortness of breath isn't normal." And so I was like, I was like, "Well, I have a postpartum, my 6 week checkup, a postpartum checkup is due. It's coming this week." So then that same week, it was my 6 week checkup that was coming up. So here it is, Monday, but my checkup wasn't until that Thursday. And so my dad didn't want me waiting. So we arranged for my mother-in-law to be able to watch our daughters. I told my husband to go ahead and go to work, and that I don't worry about it. And then my son was also with his grandmother as well. And so after that, my dad went ahead and came and got me. And we noticed that even when we got to the ER parking lot, I was struggling just to get from the car to the ER doors. So I was literally like, "Oh my goodness," I was slug bugging. So I was like, "I can't breathe. I can't breathe." At this point, I'm still thinking this sinus is a really bad sinus infection. So, but my dad, he's thinking, "No, I got to be bronchitis or pneumonia or something." Like it done turned into something else. And so once we got in there, that's when they did my vitals and everything. And from the jump, they saw that my oxygen levels was too low, because it wasn't supposed to be in the 80s. So they was like, "Yeah, it's definitely something going on." And then they also heard the fluttering in my heart, palpitations. And so at that point, I started crying, and my dad was like, "Well, why are you crying?" And I was like, "Now I know it's something wrong. It's something wrong," because they acted like it's something wrong. Okay, so I get to the back, and at this point, the hospital, they were short on rooms, so they was like we had to wait in the waiting area. for any testing or anything like that. So they sent us back in the waiting area after I got my vitals. I was in shortness of breath. And they slowly started taking me back to do like the X-ray and to do like an exam and everything. And then they also had a nurse walk with me to see how long it would take for me to go out of breath. And it took me about 5 minutes just walking with him. I told him I need to go sit down because I'm very tired now. And so from there, they saw the fluid that I had on my heart and my lungs, and they had quickly got the medicine Lasix, and they drained all the fluid. So I had immediately lost about 40 pounds during that moment. And they did a CT scan. I remember them saying they saw spots on my lungs and that I had an enlarged heart now. Me and my dad knew that we were familiar with this story because had we had just lost my sister 3 years prior to me going into that ER shortness of breath, and she also had went into the ER of shortness of breath as well. But they had ruled hers up to a natural cause death, even though she was only 27. So she never really got an official diagnosis. They just know her heart ended up, deteriorating within 6 months of her after the delivery. And so from there, I was just trying to understand, well, what was happening? Like, why is our hearts getting attacked? And so they end up doing another echocardiogram. And before they did it, I remember telling doctor, wait, I know I already did an echocardiogram, even though like in labor and delivery, I didn't know what that was, but my obstetrician knew what to send to the floor. But at this point, I was like, oh no, I already did that. It was good. My heart's fine. And so they was like, well, we seeing signs and certain signs that, they ordered an echocardiogram, so we have to go ahead and do it. And I was like, okay, so they did it. And it took a day later for a cardiologist to come up. Like, again, they was, having shortness of staff and stuff at the hospital. So once they got the cardiologist there, he had looked at my results and he let me know that my heart was failing, like the last failing, he said it was like an 80-year-old man heart he was looking at. Like he wouldn't have been able to tell that I was a 23-year-old woman. And so, and from that point, he gave me the diagnosis of postpartum cardiomyopathy. I later had found out that it's initially called peripartum cardiomyopathy because the symptoms is based off when the symptoms actually start. So my symptoms started when I felt that flutter in my heart, and then started noticing that I was, started swelling in my legs and feet. And so that's what my actual diagnosis was, postpartum cardiomyopathy, because that's when it was detected. And so from there is when he offered, well, he had to look at my insurance. So I do try to, advocate on insurance as well if we don't have it, as far as health insurance, because it can save your life depending on your struggle and situation that you're in. And so from there, he looked at my insurance. He was like, "Okay, you got approved for just about all the treatment options that we have." And so I was like, "Oh, great," And so I immediately started a cardiac rehab. He gave me medicines. There were certain medicines that he started me on just to see what could help, because at this point they had already saw in my file that nothing was helping my sister. Like her medications, her body would reject the medications. And like it was just a mystery. And so while they was trying to see what would help with me, they ended up keeping me into the hospital about a whole week, and just running tests, and then just also monitoring the medications on what the medicine was doing. They did notice a change within those few days of me being there, with my heart function. I think it had went up after the fluid was gone. The heart function like increased, but it only increased like probably a percent or two, but it was still good. He was like, that's what they want to see, is moving in the right direction. And so I was like, great, and I did have a BNP level of like, I know it was like 1600 plus. So it was up there, letting them know that okay, yeah, definitely heart related. But yeah, so after that, I ended up researching PPCM on Google, and it was like an article on there back from 2011, and here it was like 2016 at the time. So I couldn't find like really nothing up to date on the condition. And I also couldn't find other women with the condition. So I was like, oh my goodness, me and my sister are the only two people in the world who got this condition. And it came from a pregnancy. And I'm like, oh my gosh. And so from there, I was like, I already didn't feel like I had the support that I needed as far as a condition like that. And then with my sister being gone, she wasn't able to be here to help me solve the issue or walk with me through it or together at least. And so I was like, they have to have, more out here for this. So my nurses at cardiac rehab thought that my story, when they heard my story, they thought that it was a great story to be able to raise awareness for. And so they brought in a news station. And at that point, that had never happened to me before. And so, they asked me if I was okay with raising awareness about it. And I was like, sure. I was like, yeah, other people should know about it, even though like I said, I didn't know other women was dealing with it. And after that, is when it clicked in my brain, like, okay, well, if we can increase awareness for this condition, why not? And so I think it took about well, actually, like 6 months, 6 months after my diagnosis, because I had to wear a what you call it, a wearable defibrillator, a life vest is what we call it. I wore that for about 6 months while they was trying to see if my heart was increasing. Again, like I said, my heart started showing signs of increasing like immediately, but it wasn't to the point or the percentage that he needed it to be, which would be 35% heart function. And so, since it was still under that meaning if it's under 35% heart function, that means you're liable to go, or you're high risk to go into a cardiac arrest. And so from there is when he scheduled me to get an implantable defibrillator. And so that is actually a defibrillator that goes inside. They make a pocket inside of your chest area, and they stick the device like right there in your chest area, and it basically just monitors the heart 24/7, and it checks for any rhythms or anything like that. And the cool thing about it is it's a pacemaker and it's a defibrillator. So if it needs to paces, like if it needs to speed up your heart function, or if it needs to slow down your heart function, it'll do that. Or if it needs to shock you to bring your heart rhythm back, it'll do that as well. And so I've never had to be shocked, thank God. And so, but it has been doing well as far as like keeping the doctors up to date with where I'm at now. I did increase my heart function. When my heart function actually increased, it was a medication called Entresto that actually worked wonders on me, and I ended up fully recovering within 2 years of the diagnosis. And so, with the big help of Entresto, because that's the medication we actually saw a significant change in with my heart function. And it was also a new medication then too. I remember my cardiologist saying, "Hey, we have this new medication. Now I don't want you to try it, just see if it'll help." And it did. So that was a good thing about that. And then my cardiologist trying to ease my survivor guilt, 'cause I told him I had survivor guilt, because I was like, well, we could have saved my sister. Why we didn't have this information out 3 years ago? And so he was just letting me know that, a lot of things that they had tested and went over that they developed within that 3 years time span. He said that a lot of things had changed. And so, yeah, that was difficult for me to process. And so with that, I was trying to find some type of sort of healing as far as dealing with grief, and along with also accepting that I have a heart condition now while I'm trying to raise a newborn baby, trying to be a wife, and then also trying to be a mom to my son, who's, the oldest child. And he was 4 at the time. And even with him, the Life Fest people, I remember them having to come and teach us. Well, they had to come train us and train my son as well. Like, if mommy ever fall down or anything and she's not saying anything, you can't touch her, because if I had the life vest on and it was activated, if my heart had stopped and he touches me, it's gonna shock him as well, or it'll shock whoever's next to me. And in some cases, if the woman is holding the baby, it'll shock the baby too. And so that was like the only downfall in wearing a life vest. It's just making sure that your kids around you knew exactly what to do in case mom goes unconscious. And so that's kind of scary at the same time, kind of traumatic. But I think having a plan in place to prepare was beautiful on how they did that. So they made sure we at least was prepared, and made sure kids were prepared if something like that was to happen. But fast forward, I think it's 2018, I ended up researching PPCM and Facebook alone. So I didn't do it in Google because I didn't find a lot in Google. So I did it to Facebook. And when I looked in Facebook for PPCM, I saw thousands of women in this group that had the same condition, and they was telling the exact same stories. Well, not the exact same, but it was like very relative to our stories. And I was like, oh my goodness, it's like thousands of women who's going through this, and why aren't we saying anything about it? I'm like, I lost my sister because of this. Like, her kids don't have her anymore, because of this condition. Because nobody said, we didn't hear anything. Nobody told us that we was at risk or anything. So I was frustrated behind that. But I remember introducing myself, introducing my story. I introduced my sister' story as well. And pretty much after that, I remember telling the women, I was like, well, what if we can get our stories outside the group? If we could say, because the group is private. So I was like, no one is really hearing us. So I was like, if we can come up with a way to get our voices heard, or, to get our stories out there in the public, we should do that. I think it would be life saving. And so a lot of the women was like, "Oh yeah, that'll be good. That'll be, I'll do it. I'll do it." So a lot of them end up wanting to share their story. And so what I did was, while I was at work one day, I ended up thinking, actually, the Holy Spirit put it on me to create this blog page and name it "Let's Talk PPCM" because that's what that's what we wanted people to do, to talk about PPCM. So we end up naming it. I end up naming it that. And from there, is when I reached out to see who want to share their story, and we, slowly started sharing our stories on there, and just being able to advocate, giving us our own voice from this dreadful condition. Because I'm like, we wouldn't want another mom that's expecting, or you're in a happy moment of your life. So if you're able to prevent the severity of the condition, that's what we would want and what we advocate for, and the point of us sharing our story, which would be not to instill fear, but to bring or make others aware at least what you would look out for in case you feel like this is happening to you. But even then, like, even with doulaing, because now, I became a doula, a few years later, just to be able to enhance the projects of what we was doing with our organization, because the blog page ended up turning into an organization, well, a nonprofit organization, to be able to bring more exposure as to what we was doing and trying to educate with the healthcare providers, because now we notice that a lot of the patients get frustrated if they notice that their doctors aren't aware of this condition that either almost took their life or took the life of one of their family members. And so some of the doctors have never heard of it before. It's a lot of birth workers, they never heard of it before, but women are dying from it, and women are continuing to develop this condition from a pregnancy. And because they don't know exactly the cause of the condition, that's what makes it more, you know, um, I would say that that's what makes it more important to be aware of it in the first place. So with that being said, once I started the organization, we was able to pull stories from the group for these moms to be able to share their testimony. Some of the moms are no longer with us who have shared their story, which is another traumatic part that we experience, because we meet these women and then sometimes they have to leave as well. Like in my sister's case, they're here for a moment and then they're gone, and their stories is left here to basically be shared to help others. And so that's what I had continued to do. Like I said, I had a lot of other conditions that end up arising after PPCM was detected, because PPCM causes your heart to get damaged. So once your heart is damaged, it could cause the other organs around the heart to also be damaged as well. And so that is pretty much how that went and how that's been going. But as far as now, we do offer BNP blood testing and also postpartum exams for moms, at least here in Texas right now. So we hope to be able to do that in all the states and the cities and the countries, just to make sure that the doctors are able to rule out PPCM, or that they even know that it could be a cause of a condition. If something is worsening or happening in a mom and she done developed a sickness or illness right after her birth, that's just, you want to make sure you keep a close eye on that mom, especially if she comes to you whether 3 weeks, 4 weeks, or at the 6 week postpartum. And she just don't look good. That's just kind of one of those things to make the doctors aware of. So we work closely with the doctors and healthcare providers now, birth workers, is being able to make sure that they're aware, and they know what symptoms and signs to look out for, and then also how they can go about treating the moms, and especially like even if it's lack of insurance, because we have moms that don't have insurance or they're not able to get the same treatments as everybody else. And so we've been trying to actually find the solutions to those problems. And it's been a rocky road, but we're slowly getting there. We're going to continue to share our stories. We're going to continue partnering and working with the healthcare field, just to being able to make sure that the patients or the newly diagnosed moms have the resources and the information that they need, even if we're not sharing the awareness directly with them, because obviously we don't want to instill fear. So we partner around them just to make sure that they're able to get the treatments and the help that they need in a manageable time. Because PPCM is one of those conditions. If you don't catch it in time, the whole heart can become damaged, and at that point, your heart, they will have to replace it with a new heart. And that's not an easy process. A lot of the moms that had to go through a heart transplantation tell you how not easy of a road that is. But a lot of times people treat it as if it's easy because, oh, okay, you're healed now. You're fine now, your heart went back. But a lot of times they still, have symptoms. They still go through certain things like shortness of breath, swelling, maybe. They probably can't eat the same anymore. They probably can't even, do a lot of excitement things anymore, that can cause an increase in your heart rate. So even exercising, you have to be careful where you exercise. So it's like, it's certain things that come into play. Mind you, these women be new moms. So you're talking about you just had a baby, and then a couple of weeks later you need a new heart. Like that's such an unfair situation. So I think, the more awareness, the better. And we have been seeing a lot of more stories out about bringing awareness to this condition alone. So we love it, and we hope it continues.
Beautiful, beautiful story. Tragic, beautiful, meaningful story. Bree, thank you so much for sharing. So sorry about Crystal, your sister. Brianna did write a book about her story. It's called A Life on Pause by Brianna Harris Henderson. And I actually gifted my husband's cardiologist with my book. So just last night, I ordered my new copy of it. Great. But he and I, the cardiologist and I, had both discussed the fact that by the time cardiologists get brought into the picture, it's really too late to prevent or really turn things around as well. So the diagnosis has to begin with in the obstetrician or midwife's office. And isn't it true that the symptoms of PPCM are so similar to symptoms of third trimester pregnancy, as far as swelling and elevated blood pressure, correct?
Right.
One of the special things about midwifery care, out of hospital births especially, is that women are so carefully screened for any symptoms that would, as they say, risk them out of hospital delivery. So the women who are having their babies out of the hospital, we know that they're in a perfect state to do so. And that's why we have just the most wonderful, healthy, successful births out of hospital. Because if there are any concerning symptoms, they get turned over to obstetric care. But my wish is that at the very first sign of anything that's different, that they are immediately screened for cardiovascular issues. Um, and I
Right.
believe that too often obstetricians may just attribute the symptoms that their patients are expressing to them are due to late pregnancy,
Mhm.
or if they're showing signs of preeclampsia, um, they'll right away schedule an induction. So then we're taking a woman with a failing heart
Mhm.
and and subjecting her to a labor induction.
Mm.
What we are advocating um, is at the very sign of typical preeclampsia symptoms, um, that the first thing that's done is a referral for a blood test for
Mhm.
BNP. B type natriuretic peptide is what
Mhm.
BNP is. And it's a chemical that is put out into the bloodstream, indicating that your heart is not doing well. So simple. Take a blood test. Elevation of BNP, an echocardiogram.
Yes, and
Numbers.
especially if the doctor is, hesitant, if, because like sometimes we'll have the moms that are interested in having the blood test done. They'll come back and say, well, my obstetrician said I'm too young for heart problems, so she didn't do it, and we'll be like, so she didn't do it because she think. So she went off her thought, her understanding, because you look like you wouldn't develop a condition like that. You're not going to give me a test that I'm paying for or that, my insurance can cover. So that is kind of seem like an issue as well, So at this point, we do tell moms if they do hear that the doctor needs to have a note and include in the note that they refused to order this BNP blood test for this man who was concerned to rule out PPCM because she either felt a flutter in her heart or she started swelling like crazy or she may have developed a cough, and this could be during I would say the last few weeks of pregnancy, during up to those actually 1 year postpartum, because we do have a few survivors who didn't find out until a year later that their heart was damaged. So you telling me that I've been living, this living life like great, thinking that everything is okay, and then a lot of times women get pregnant back to back. And if you're not knowing that your heart is weak from the previous pregnancy, then that can also, cause a shift in how things are going to go. Because a lot of women that do develop PPCM, they are asked if they are able to have or go on to have more children. And that's the question that the doctors really don't like answering, but they answer it with no. They don't want you to have any more pregnancies because obviously you're pregnant. If you get pregnant, your body itself, like the body that you have that has this genetic trait, because that's what PPCM is, a genetic disorder. And so if a mom has it, then you're liable to develop it again with every pregnancy. And so the moms that do go on to have more, they just kind of, either not have a choice. But with what we're seeing is that some of them relapse and some of them don't. Some of them get pregnant again while their heart is still severely low, but then it increases with the pregnancy. So it's like it just you never know which mom will relapse or will actually heal if she gets pregnant again. And so that's the another weird thing with PPCM. But again, that's why we needed a foundation in place to be able to focus on those certain things, because it wasn't really a foundation out there to focus on the research portion as far as why do we see this happening in certain moms, or even in my situation, why did my sister why did her body reject the medication that they was giving her? Like we still didn't find the answers to that. So they couldn't find the answers to that. They was running tests like crazy on her, but again they couldn't figure out. So like when I remember seeing her death certificate, and it said literally natural cause of death, and she was 27. I'm like, who typed that in there? That was like that was not what it was. But because they didn't have initial diagnosis, so then I thought, how many other moms are actually getting that put into their files, and it should say PPCM. Even my grandmother, when my sister was going through all that, my mother's mom, she was saying that, oh, well, after her last pregnancy, which was third pregnancy, she was told not to have any more children. This was in the early 80s. And, they told her that her heart was not, that her heart was weak. And so they was like, if she had another pregnancy, it can possibly damage her heart. And so she was like, oh, okay, she took that into consideration. She didn't have any more, but we never heard of any of that until my sister got sick. And so that is when it was like, oh, well, but the doctors, when my granny mentioned it, it's like no one really paid attention to it because I mean it didn't have a name. It was just regular heart disease, and then she had diabetes, so that could have been a trigger for that, right? And so that's why we didn't really uh, put two and two together then. But now thinking back, I do think that my grandmother had it as well, and that it went undiagnosed in her. And end up jumping to my sister because it skipped my mom because my mom was able to have two girls, which was me and my sister. But the only thing that happened with my mom that was a genetic trait or that happened was her developing breast cancer. And they told my mother that her breast cancer was a rare form. She died in 2006, but they did tell her that she had a rare form of breast cancer from not breastfeeding. And so they said that so they said because she didn't breastfeed, it was a tumor that developed in that duct, in the milk ducts. And so just a rare form, but it was one of those rapidly growing type of cancers. So then I learned later that, oh, the more you breastfeed, it can, what you call lower your risk for developing breast cancer. So I wanted to make sure that I was breastfeeding, so obviously to lower my risk or my chances of developing that in the future. Because my mom developed breast cancer around 31 years old, and she passed away from it at 34. So, and, with that, I was breastfeeding, but when they told me that, okay, well, your heart is severely damaged, you can't breastfeed anymore. And so that was another part of research of what medications would work well with me breastfeeding. So at this point, I was devastated because you're telling me that I can't breastfeed, and I know that I have to breastfeed to be able to kind of help my health in the future and also to help with my baby with her development. And so yeah, that kind of broke me then, but it breaks a lot of moms who they tell to literally immediately stop breastfeeding. And that's a whole nother mental state in itself. Just so it's so many obstacles that are getting thrown at us as soon as you get diagnosed with a heart condition. But the good thing that I can say about PPCM is that when a mom gets it, and it's caught on time, the symptoms are caught on time, she has a 90% chance of recovering fully, whole heart. Your heart just recovered spontaneously. Even without like medication. Some moms, they choose to not medicate. Some moms are completely natural, and that's fine. So it works both ways. That's why we have to have again the foundation in place to be able to know the scientific measures of exactly what's being affected and what's not. And so that's the main part.
Thank you. Um, Bree, as far as the cause, we know that there is a genetic component. We know that actually the gene can be passed from the mom's father as well. So unfortunately, my sweet friend who did develop it after her second baby, her father did ultimately pass from heart disease. He was hospitalized awaiting a heart transplant, I believe. So yes, I don't know whether or not, do you know, Bree, if there is a test for the genetic marker for cardiomyopathy?
Uh, I do. Actually, they do have a genetic testing out for that. It just like before when I tell or explain it to families about the genetic testing, because a lot of the moms they'll be like, "Oh my God, is my kid gonna get it? My baby? Do I have to worry about it, or do they have to worry about it in the future?" Now the thing with that, I just always tell them make sure that if they don't already, to have at least a policy or life insurance policy in place, just for educational purposes before they run the genetic testing, because if they do and it comes back positive for their child or anybody else in the family, it will cut them off from getting benefits as far as, and that'll be for the rest of their life. They won't be able to get no insurance because they parent wanted to run a genetic testing on them and they didn't have a policy in place. So that's just a big thing that I do let families know before they do that. But there is a genetic testing that'll let them know if the trait came from mom or dad.
Thank you. That is really good information. Also, there can be a viral component. It's basically, the condition is garden variety cardiomyopathy, garden
Mm,
variety heart failure that happens to manifest in pregnant or postpartum women.
mhm,
There are a collection of viruses that can damage a pregnant woman's heart if she contracts the virus while pregnant. One of those viruses is COVID. Um,
mm,
that has been proved, and
mhm.
that contributed to the unfortunate cases of pregnant women not doing well. Um,
Mhm. Yeah, that's another thing that I believe Dr. Fett actually brought that to our attention in our PPCM group, and he was just saying that there's a relative similarities there as far as the what COVID can do with the heart, and how PPCM affects the heart is basically similar. And so, with that being said, is why we felt like or felt the need to add COVID. Like if a mom done had COVID-19 within the past and she never had her heart function checked, or she never had a BNP blood test done, it would be basically like a risk factor, a part of a risk factor is what we rule it as, under the organization, just to make sure that moms are clear if they done had that, COVID in the past, just to make sure their heart didn't get affected by it.
um, we're hearing talk of placentas delivered after um, a mom has had COVID, um, and recovered and subsequently delivered a baby, but that the placentas appear different than the ones from
Yeah,
the
yeah,
parents.
I
The
did. I think
placentas.
I've also saw proof of that as well, with the difference of the placentas.
Yeah. So it's real. Um,
Mhm.
Dr. Fett that Brianna mentions. Why don't you explain who Dr. Fett is, Brianna?
So he's actually a cardiologist. He's been in the field for years on. I was well past 20 plus. And he's basically been researching a lot. He's been researching PPCM within Haiti and Nigeria, I believe. I believe mainly Haiti. He was studying because women in Haiti actually develop PPCM. 1 in 300 moms develop it. So they get it like continuously there. And so he was interested because it actually personally affected him in his life, which is what brought him to want to research about it and just get as much information that he could about it out. And so he was a big help in understanding after I know I was diagnosed and after any mom is diagnosed, as far as answering questions, just being there for support, and like any type of awareness that we do, he's there. He makes sure, or he's cheering us on from afar. But he did retire out of his advocacy work for PPCM, and so he's passed his torch on to the survivors, on the ones who do want to keep everything going. And we make sure that we mention him so everybody could know that we did have, a cardiologist that was really dedicated to finding out more about this condition.
Um, and I think he's in his 80s right now. And
Mhm.
if you research on, all of the scientific publications on peripartum cardiomyopathy, he will have authored the lion's share of the early articles.
Mhm.
Dr. James Fett, Fett. And Brianna in 2021 participated in a webinar presented to ACOG, American College of Obstetricians and Gynecologists. So they are aware. They are aware.
Mhm.
It's just not at the front of their minds. And so if your client requests a BNP test of their provider, because I feel XYZ, the provider, I believe, will understand what and why, hopefully. But another part of our efforts, and this is why when Brianna does her, her addressing groups of healthcare providers, it is most often to medical professionals. Um, and nurses, yes, but the nurses are basically there to help the doctors and be there on labor and delivery floor to assist families. But nurse midwives, they're frontline. But again, they are the best screeners in the world, as well as professional midwives, to make sure that their patients are in primo shape to do an out of hospital birth, if that's what they're doing. So again, for doulas, it's not out of our scope of practice to listen when our clients tell us, this is how I'm feeling today. For my doula clients, I'm not taking them in the field now because I'm passing the torch on to the younger ones with better backs than I, or older ones with better backs than I. I'm more into education now. But my message to my clients is always, anytime the way you feel is different from the way you felt the last time you spoke, I need to hear from you. That's especially important if they're close to going into labor, because that's how I know to kind of get my antennas up higher. But what I wish for birth doulas is to, if they hear of a symptom, to then be able to, as we empower our clients for everything else we do to, advocate for themselves and their needs with their providers, to strongly advocate for themselves to receive the proper testing is out there to ensure that their heart is in good shape.
Exactly.
And then, as important for our postpartum doulas, it's those early postpartum days that are so tenuous, and so if you see something, again, if you're a postpartum doula, you can accompany your client to go in and get checked. And unfortunately, as far as the demographics for peripartum cardiomyopathy, there is an unfortunate discrepancy in African American patients versus other races. Is that correct?
Right. It sure is. It sure is.
Do you know what the percentages are?
So it's like 10 times probably higher for Black women alone out of any other race.
And unfortunately, and that would probably be the genetic factor.
That's another thing. If they carry that trait.
unfortunately, it's the women who um, don't have the means to hire a doula at the cost that, at least in Southern California, doulas are charging, and postpartum doulas. Many women can't afford that type of care.
Mhm.
And which is why it's so incredible that Medi-Cal, which is
Mhm.
California's Medicaid, and some states' Medicaid programs are
Mhm.
also providing coverage for doula care.
Mhm.
Medi-Cal definitely is. Um, I don't have all of the states right now. I don't know, um, but I certainly will get that exact information. But what's important to me now is to make sure that doulas who are now registering with Medi-Cal and Medicaid to get the information about peripartum cardiomyopathy, just
Right.
so they are aware and can know what to look for. And then they are the ones who will be available to these patients um, who might be diagnosed, because Medi-Cal and Medicaid patients are going to get to have doulas and
Mhm.
postpartum doulas.
Exactly.
Medi-Cal and Medicaid are going to pay doulas, postpartum doulas, to go and be with women who've just come home from the hospital with their new babies. Thing that being a postpartum mama involves, which is so much. And if can you imagine coming home with a brand new baby and a family and a new diagnosis of heart failure?
Mm.
So I want to, so I am going to get this information to doulas and help them understand. Um, but I also want um, obstetricians who
Mhm.
are accepting Medi-Cal and Medicaid patients
Mhm.
to be even more aware than they already are, or
Right.
reminded, um, be reminded
Yeah.
to
That is
just
great
consider
information.
that condition, please, doctor, please. Just rule it out. Please,
Mhm.
just rule it out.
All we're asking is just to be ruled out. Not saying that she's gonna develop it, not saying she's gonna get it, she's the one. It's just ruling out, just a peace of mind. That's really all we want. Make sure that moms have that peace of mind. I did want to piggyback on something as far as like them not paying attention to it right now. I was told in the past, a little bit after the ACOG interview, that they it's it hasn't reached the 200,000 mark of moms getting this condition. So since it was known to be under the 200,000 of women developing it a year, that is why kept it as rare, or they consider it as being rare. So many of the new doctors, the new obstetricians that come out as students, they say, "Oh, I remember seeing like a small part about it in our book, just a small part," but it wasn't enough for them to remember. Like, what is that? So then when you come back and you ask the doctor about it, it's like, oh, what is that? And they can't really tell you about it. And it's like, oh, yeah, okay. And then a lot of times, like, if you don't know about it or you're not aware, now, as far as being an advocate for maternal health and all, we're letting women know that you have to interview your doctors now. Like, you have to, and what if that came up? Do you know something about PPCM? Are you able to answer that question for that patient at that moment? Like, if you was to get hit with it in the future, even though, like, it was told to you to be rare, but it's happening every week or weekly. We're seeing new moms getting this diagnosis, and it's like it's getting worse. It's more women, and it's not just in the African American race. Obviously, it's all over. It is everywhere, and so it's like at this point, no one is keeping track of how many moms is actually getting it. And then even those like my sister, hers on the death certificate was what, it was a natural cause, So if you were seeing that it's so many natural cause on these pregnant women, like if we was to actually go back and look at all the women who done died of a natural cause, like probably within a year's time after having a baby, what really happened, because we do know that now that preeclampsia can lead to PPCM, So even though I wasn't diagnosed with preeclampsia, but I did have the high blood pressure like a mom with preeclampsia, but I didn't have no protein in the urine. A mom with preeclampsia would have protein in her urine. So it's like it wasn't really a factor and something that we would go off of, but I know that Dr. Fett did coach us on the fact that preeclampsia was linked to PPCM as well as COVID, and some other things as well. So it just, just being able to know your body, the history of your body, and in some cases, I can't say your family history because a lot of times we don't know our family history. Like my granny, she didn't know to say something about having a bad heart and pregnancy until it got to my sister, so it's like a lot of times we don't know these things and we don't know exactly what to ask for. We're just hoping that everything is going to go good. So I do like how you want to educate the doulas and obstetricians because obviously they will be the ones who will notice. And I think you told me, Miss Jody, that like, do I feel like if I would have had a postpartum doula around that time, would I have felt like she would have caught it? And I'm like, yes and no, because at that point it was never heard of. So it was like no one knew what that was. So I don't think my postpartum doula would have caught on. But as far as now, with all the awareness and everything, and how it's been brought up in the forefront, it's been on news articles, you're seeing it everywhere now. I think so. Yes, I think postpartum doula would definitely be able to determine like, oh, girl, I don't know. That sounds like you got shortness of breath. You developed a cough. You feel like what in your lungs? Like it's like certain things. You don't have to scare the mom. You don't have to react in a frightening, oh my gosh, I think this is a PPCM mom. Like, no, we're going to keep calm. You're just going to take notes of everything that mom, and then you're just going to suggest to her, have you ever heard of a DNP blood test? Just throw it at her. She's going to be like, no, what is that? And that's when you fill her in, I just think it's something you should get just to rule it out. And then if
Exactly.
anything else was to come up and they find anything else, it wouldn't be PPCM. So you wouldn't have to worry about your heart deteriorating over time while they're trying to find out if it's something else other than your heart. They need to make sure it's not your heart first and then go to the other measures.
Especially if they're looking at, and okay, as far as rule it off first, back to preeclampsia,
Hmm.
before we schedule an induction,
Hmm.
at the very
Yeah.
least.
That can actually exacerbate the symptoms. So we did know. So Dr. Fed coached us on that as well. If the mom is getting a C-section, that C-section can cause her to go into a cardiac arrest. And it has happened. It done happened to multiple of our survivors. They survived to tell the story, thank God. But it did happen to them. They are code right there on the table. And then so they have to sit there and cut the baby out, and then they resuscitating the mom at the same time. So you're trying to get the baby delivered, and you're trying to figure out why this mom heart done stopped on the delivery table. So yeah, very serious condition.
And in sharing to my Facebook friends about this event,
Mhm.
and let's talk about PPCM. I was hesitant to make this presentation public because I don't like, we want to raise awareness. American Cancer Society, the Extraordinary Lives Foundation for Mental Health,
Mhm.
um, American Cancer Society, heart disease, but just general heart disease. Yes,
Mhm.
but I want to keep PPCM publicity under wraps
Mhm.
because I don't want mothers and sisters and friends of pregnant women
Mhm.
to get this information and start trying to worry their loved ones about
Yeah. Mhm.
normalcy, the normalcy and the how healthy a physiologic birth is. Because
Only if they're like my dad.
Yes,
Like, nah, that don't sound normal. You need to go to the
yes,
hospital
yes.
right now.
Right now they're trying to decide whether should I get an amniocentesis?
You're all over the place.
No, no, I don't even want it to be
Right,
in their airspace.
right.
Only if they feel something different. See
That's
something.
right.
So
Yeah.
that is why I feel the need to approach this carefully. And I know you said the same thing before. So we
Mhm.
are um we are in the same place.
Yes, and
We're in the same place.
PPCM is, a lot of people don't know, but PPCM is actually one of the leading cause of maternal deaths.
It is.
So,
It is.
and
In
especially cardiovascular disease.
yes, when we in I rewatched your ACOG
Mhm.
webinar several times this week,
Ah,
and and
you.
they pointed out in the graphs and charts that probably was it like 3/4 of maternal deaths
Mhm.
are due to cardiovascular disease.
Right,
So
right. It's up there.
that's what it
It's
was.
up there.
So, um, and before we close off, the timing for me personally for wanting to just get to work
Mhm.
um, where I am right now is the fact that California Medicaid, Medi-Cal, is now paying birth and postpartum doulas for
Love
their
it.
services. And and it's probably going to, because the compensation
Mhm.
is not probably not on par with many doulas fees. Um,
Mhm.
we may have some newer doulas who are going to be participating in the Medi-Cal program. Um, but it's happening right now. So
Mhm.
my effort right now is getting together that group of doulas to inform them about this topic,
Mhm.
and then getting a reminder to the obstetric providers who are working with Medi-Cal patients. So
Mhm.
that is my why for why I am doing this now. And so, and Brianna is going to be coming west in I don't know when the A1.
It's next year sometime. I'm not sure exactly what month it is yet, so they're still providing me with details. They're gonna be providing me with details over time, but I think they're located in Washington, but they're gonna be actually having the meeting in Arizona.
In what
ACOG members and then CDC members as well. That's gonna be a part of the audience, so it'll be great.
per years of research, um, but just to have the story in person by you
Mhm.
would be, I
Mhm.
think, very moving for them as well.
Oh
So
yeah.
I'm going to say good night to you and everybody, and and may the Medicaid expansion for doulas present itself in Texas, but luckily in Texas now they've pushed Medicaid coverage
Mhm.
for postpartum women from 3 months to 12 months.
Yes, that happened this year.
Yes, yes, it just recently was announced. So thank
Mhm.
God there. So if
Mhm.
women are diagnosed 12 months postpartum, within the 12 months postpartum, um, they will have insurance coverage.
Yes, beautiful.
Okay. Good night, everybody. Thank you for listening to our
Thank you
story.
for having me.
Bye. Good night.
All right, Miss
Yeah.
Jody.
Bye.